and women who have actually born children or women who are planning to give birth. Personally, I am someone who is very afraid of birth. And so we know that when it comes to giving birth, I've done so much research into the different ways, because when you watch a movie and you see the woman screaming, it just turns me off so much. I don't want to do that whole screaming, but no, I want my baby to just be there and bloop, the baby's out. That's how I want it. So I've done a lot of research into epidurals, cesarean sections, natural births, water births, but today we are actually going to talk about cesarean sections. Of course, my small research is not going to get us far. So we have with us our resident midwife, Mrs. Vida Asante. Hi.
Hi.
Mrs. Asante, good morning.
Good morning.
I'm very glad to have you with us.
Thank you very much.
It's an amazing day. And we're looking forward to this conversation on cesarean sections. Most people say C-section, C-section, C-section. So tell us exactly, what is a cesarean section?
Okay. So I'll say cesarean section is a cut to take baby out of the mother's abdomen or uterus. So you cut the abdomen and then you get to the uterus, cut it, and then you bring baby out. That is all about cesarean section. Yeah.
Okay. And what is the reason for cesarean sections?
Okay. So I'll say that we have a lot of reasons. Yes. And some can be due to the mother, or can be caused through the mother. And then we have the fetus or the fetal causes.
Okay.
Yes. So let me take the mother.
Please
Let
go
me take
ahead.
the mother, yes. So with the mother, you know, if you're pregnant for the first time, or you've had previous cesarean section or any other surgery that is contraindicated in vaginal birth, then you fall under that criteria. An example of such procedures can be myomectomy, which is the removal of fibroids.
Okay.
You know, when these fibroids are taken out of the uterus, it brings a lot of scars on the uterus, and a scar is something that cannot stretch during labor. You know, when labor starts, the uterus contracts and retracts. So as it contracts, it expels the fetus out gradually. So this process with the scars on the uterus doesn't allow it to go through that kind of process successfully. So you might end up having a rupture or a tear because the scar itself can't stretch. And this time around, you are exposing it to stretch. Yeah, so that's an indication for CS. And then it can be that you've had, let's say, sapingectomy, or I would say ectopic, as most people normally say it, ectopic. And this ectopic, we know, is the conception outside the uterus. So you can have it in the fallopian tubes, you can have it on the cervix, which is very rare, you can have it in the abdomen, which is called abdominal pregnancy. But this time around, let's say it happened close to the uterus. Yes, it happens close to that. Is that section, we call it the cornua. So if they take it out of that place, it means it is very difficult for you to go through labor, and you are a candidate for cesarean section. Yes. And also we have genital herpes or herpes. If there is this mother who has this genital condition, it can be warts or any serious genital condition that if the fetus passes through the vagina through birth, the fetus or the baby will have infection. So preventing that infection, we rather prefer you go through cesarean section rather than vaginal birth. And also we have dystocia. Yes. And dystocia is inability of the contents of the uterus to come out. It can be due to many factors. Yes, it can be due to the fact that the cervix is not able to dilate, even in the presence of good contractions, because contractions expels the contents, which is the fetus. And through these contractions, you know, when the fetal head is well applied to the cervix, it causes the cervix to dilate very well. So this time around, there's good contractions, but the cervix is failing to dilate. It's a kind of dystocia, or which we call cervical dystocia. And then we have It can be that the fetus is very big. Yes, which is making it unable to come out. It's also a form of dystocia. So inability of the content of the uterus to come out makes it possible or makes you a candidate for cesarean section. So we have maternal exhaustion. You know, mothers go through, the labor process itself is very tedious. It is work. Yes, and in the course of the process, some mothers get exhausted, if I may say. And when she gets to that stage, it is very difficult for labor to progress. So we have no other option than to take you to the theater to section you. Yes. And we also have failure to progress as the failure of labor to progress. Sometimes contractions are very good. Cervix will be dilated and dilate to a point, it decides not to dilate anymore. So when it gets to that stage, we have to section you. And then we have APH, or antepartum hemorrhage. So you know, when a mother, someone gets pregnant, you are not supposed to see blood as soon as you get pregnant. So if you start seeing blood, then it's a concern. So this time around, you can be term, or you can be due for labor. You can also not be due for labor, but this time around you are bleeding, which is called the APH, antepartum hemorrhage. And this bleeding can be due to different causes. It can be due to the fact that you have previa placenta, or the placenta is close to the lower uterine segment. So in the course of labor, it decides to detach itself, or you start seeing bleeding, because the lower uterine segment is not good for placenta implantation. And also, the placenta this time around can also decide to detach itself before labor starts, or before you get to term. So you know, the fetus is getting its oxygen and food nutrient through the placenta from the mother. So this time around, the placenta is detaching itself from the uterus. Then it means you see blood. Some are concealed, of which you can't see any blood outside, but then it's happening internally. But some also happens that you see blood, the woman starts to bleed heavily. And this is an indication for cesarean section. We don't allow you to go through labor. So straight away, you'll be prepared to the theater then to be sectioned. And also, we have a prolapse. And this prolapse is a fetal indication, I'll say. So, you know, the cord is attached to the cervix, transporting nutrients and oxygen from the mother to the fetus. And the mother has gotten into labor. And then this time round, this cord decides to come out around the fetus, which is called cord prolapse. So meaning when it comes out like that, it means the presenting part of the fetus will press on it at the cervix area, or at the area of the cervix. And when it presses on it, blood supply to the fetus is cut. So this time round, we can't allow you go through labor. We have to section you.
Let me chip in and ask you something. Pacho, can there be a situation be where first time mother onya nyema bibrewe o kind onya bi, but she just feels like she doesn't feel like pushing. First time mother without all the things that you stated, but opese oya C-section keke, like, is that one too there?
Yes, we have it. That's maternal request. You know, some mothers want to give birth on their birthdays. Some want their husband's birthday to be same as their babies. So, and some too want theirs on a particular date. So if you attend within that date, then we can decide to section you. That you haven't entered labor. So that's maternal request. It is also accepted. Yes. And some mothers also doesn't want to go through labor, as Aiko said, yes. So I said,
she's so happy she keeps doing this.
I said labor is really work. That's why it's called labor. So the pain of labor, she doesn't want to go through, so she decides to give birth through cesarean section. Yes.
Okay. You've spoken about the indications for emergency C-sections, but are there times where, right from the day that you meet a mother, maybe the first time they come into the OBGYN, you say no? You, for your case, we are going to do C-section, no conversation about it. Do you ever have such circumstances? Who do they happen to? Is it maybe some mothers are at a risk of certain things that they get exposed to C-sections options early?
Oh, yes. No, there are some, I would say maternal morbidities. No, there are some mothers who have medical conditions before getting pregnant. Yes, some are diabetes. Yes, and then some mothers who can be having hepatic conditions, liver conditions, so conditions that deteriorate their
Body organ.
yes. So in such conditions, we start counseling you right from the start that with this condition you have to go through section because we don't want to stress you. Yes. So we start psyching you right from the beginning, even though you might like to go through labor, but we psych you from the start that because of this condition you have to. And there's something in the course of pregnancy, as pregnancy is advancing, she gets certain conditions like the pre-eclampsia. I know she didn't get pregnant with the high blood pressure, but in the course of the pregnancy it came, and then it changed her condition. So such a mother, you counsel her that she'll go through cesarean section.
Yeah. Well, I don't know if I should call this a myth. But there's something that I've heard that when you have the number of times, like a woman is not supposed to proceed when she has had C-section. So she can't have C-section after 2 kids, after 3 kids. What is the number that you think? Yeah.
No, C-section, you can have another one being done after 1 surgery. So if you do first cesarean section, you have the chance of giving birth naturally the second time. That is if you get pregnant after 2 years. But if it's before 2 years, we don't allow you to go through labor. Because I said earlier that the uterus, when there's a cut on the uterus, there's scar formation. And when this scar goes through labor, overstretching of it causes it to rupture or tears. Yes. So the uterus tearing in the course of labor, meaning the mother will bleed. And this bleeding, I said earlier that some are concealed. You can't see some. By the time you realize the mother is going off, meaning she has bled into the peritoneum. Yes. And if by God's grace it's not the concealed type that you can see per vagina, then you can take emergency actions. Yes. And sometimes too, I would say after 2 cesarean sections, you are not allowed to deliver per vagina. Yes.
Rather, that means that when you do a C-section, that means you have to keep doing it. Is that what it means?
That's after the first. If you do 2, from 2 going, it means you can't do vaginal birth.
You always have to do a C-section.
You always have to do it.
Oh,
and
okay.
They normally advise that after 3 C-sections, you don't go further.
You don't have kids.
You don't go for the 4th one,
for the 4th
which is very risky, because this same scar, as the uterus is expanding, because fetus is growing, is putting pressure on the scar, the uterine scar. So even though you are not in labor, you can be 32 weeks or 8 months. You can be 28 weeks, which is 7 months. But because the uterus is overstretching, it can cause it to rupture. Yes. So we don't want to expose you to this risk.
Talking about this complication, now let's drift into the complications of C-section. Are there any complications that, mothers have to psych their mind into when they are getting into the process of C-section?
Oh, yes. No, with the diabetic mothers, diabetic wounds are very difficult to heal. Yes, so a diabetic mother going through C-section, wow, you can imagine how fast would this wound heal. So you can have wound complications, and you can have this same wound complication. You can have wound infection. Yes, your wound can be infected, especially with those whose abdomen are very
Flappy,
yes,
yeah.
that it has fall on the incisional site. No, it doesn't allow air to
Pass.
pass. Yeah, so with that, you can get wound infections. Aside that, too, there is hemorrhage. You can bleed. You know, the tissues have been cut, and in the course of maybe suturing, you know, anything can happen. Though the doctors are very careful to make sure everything is on course, like everything is done well, though, but you can bleed, which is called hemorrhage. Yes, and aside that, you can have uterine infection. The endometritis, called endometritis, infection of the uterus, because instead of let's say going through vaginal birth for fetus to come out without anyone tampering with the uterus, this time round the uterus was tampered with because it was cut. Baby came out, and then they went in to bring the placenta out. So you can have infection of the uterus. Yeah, and there can be mortality, which is the last
Death.
one. Yes.
Death. Wow. I mean, are they?
Which
Do
is
you?
that one actually it's very rare. Yeah.
Do you prepare a patient's mind for, and what are some of the things you do to prepare the patient's mind, body, and everything for C-section? Are there some things that they should eat, they shouldn't eat? Are there some things they should do, they shouldn't do before they perform the C-section?
We have psychological preparation. Even me as a midwife, if you tell me I'm to go through cesarean section, even though I know the whole process and I'll still panic. Yes, so I have to be counseled. You have to counsel the mother very well. So psychologically, she needs counseling. And then when she's good or okay with the counseling, when the date is due or the day is due, you give her to the anesthetist. The anesthetist also like the woman passes through some kind of preparation through the anesthetist as well. When she gets to the theater, she has to be given anesthesia. And this anesthesia, I have to explain to the woman what the anesthesia is and how she will go up, like after the anesthesia, the complications, the possible complications she's likely to have. She has to know all this before the surgery is being done. Yes.
Okay, so let's talk about the anesthesia. What medication is used for C-sections?
The anesthesia aspect, I can't really give the medications, but the midwifery aspect, I would say, the woman is supposed to be hydrated very well, yes. And prior surgery, we advise for 6 hours, there shouldn't be food. You shouldn't eat 6 hours prior surgery. And there are emergency CS though. Mother is in labor, we are encouraging her to take in more fluids, eat, because when she gets to the second stage, she will need secondary powers or maternal effort to push. And this time around, labor doesn't progress and you are rushing her for cesarean section. So that's an emergency, even though she has eaten though. It has to be done. Yes. Yeah. So that aspect, I would say, is how should I even put it?
Like maybe it's not in that side. Anyways, so what I want to find out is, you were speaking of emergency C-sections. You were even speaking of people who want to have delivery on a certain day at a certain time. Can a C-section be done before a woman is due? Like maybe if they are due for 40 weeks, can it be done at 36 weeks?
Yes, it can be done at 36 weeks. And it can even be done less than 36 weeks.
Okay.
Yeah, so it all depends on the condition of the mother and then the condition of the fetus.
Okay.
Yes,
okay.
so
that's what I was about to ask.
Yeah, so I said earlier that there is APH or antepartum hemorrhage. And this antepartum hemorrhage, I'll say the fetus is just 28 weeks. So what we normally do is, the obstetricians prescribe medications to mature the lungs of the fetus, the fetal lungs, before the surgery is done. That's if it's not too emergency, but maybe you have a day to go. Maybe they can buy time for about 24 hours. And you are giving this medication to mature the fetus. Because when the fetus comes out, the fetus must breathe. Because in the utero, it's not breathing. And when it comes out, it must take in air. So if the lungs are not well matured, there'll be difficulty in achieving this purpose. So we give medications to mature the lungs. Yes.
Okay.
And aside that, maternal medical conditions, yes. So let's say the mother has PIH or pregnancy-induced hypertension, but we are trying very well to manage this hypertension, but we realize the BPs are not well controlled, aside all medications being served. So this time around, we decide to end the pregnancy, even though mother is not term. Yes.
Well, this question I'm about to ask you, and I'm sure my viewers too definitely want to know. I have watched movies, and from what I know that where we are from, when you say baby I free Africa, Ghana, India, CSK, yeah, or moda. Like you do it whilst they are sleeping. But I've also watched movies where the mothers are awake, or even documentaries where the mothers are awake while you're doing the CS and everything. Immediately after the baby's out, they put the baby on the mother's chest. Which one is the safest?
Okay, in Ghana here, we do what you are saying.
Oh, you actually
yes.
do it.
Yes, I don't think it's not safe to have a C-section with the mother asleep.
Yes, right? So there are some conditions that makes it possible to make you sleep while section is ongoing. Yeah, so that one is intrapart, in the course of the surgery. Maybe the anesthetist notice there is something is not going on well. Then with that, they have to put you to sleep and manage you well. But aside that, you walk to the theater and you are given spinal anesthesia. So C-section or any surgery below your umbilical area, they give spinal anesthesia.
So that's the
so you are
epidural.
awake. You are widely awake, and then we take out the baby. Yes.
Okay. Epidural.
Epidurals.
Okay, so with the epidural, can you can push with the epidural?
Yes.
Or you can still push with the epidural.
Just that you won't feel
You
the
won't
pain.
feel anything. Epidural gang all the way.
Epidurals still have their risk,
Yes.
but
They
that's
do?
not even what we're talking about
Okay.
today. I'm talking about cesarean section.
Okay.
Yes.
So let's go into oligohydramnios. That is when a condition where the name sounds long, but that is when a mother might not have a lot of amniotic fluid in the sac. And so with conditions like that, is it safe to have a cesarean section?
Oh yes, it is safe, and you can go through vaginal birth as well.
Okay.
Yes. Just that they say the liquor is not adequate enough in the uterus. You can go through C-section, and then you can go through vaginal birth as well. And even if it is more, which we call polyhydramnios, can still go through C-section and then vaginal birth as well.
I mean, if you find out that a mother's the liquid is not enough, and you want it to be enough, is there something that you can do?
Okay, what we do is we just advise you to take in enough fluid, enough water, and with that one, it's just a percentage. Yes.
And what of the one that is over?
That one, in some cases, it gives you the mother discomfort, and then it gives a signal that the fetus might not be in a good shape. Why is the fluid more than excess? Yes. Even though that's not what we are discussing now, I can say little about that. No, when the fetus is in the utero, he's supposed to be drinking the fluid, urine in the fluid, yes, and then drinking some. So this time around, the fluid is more than excess, the amount we expect. So what sometimes comes in mind is, then it means there could be a blockade in the throat, or maybe through the
cord.
No, like the digestive system.
Okay.
If I put it right, digestive system. So fetus take fluid and it's not able to go down for it to be urinated back in the fluid or in the sac. So it gives a signal that maybe there is something there. Maybe we call it atresia. Yes. And it gives a lot of signal that fetus might not be in the good or the best condition. Yeah.
Okay, we've spoken about the complications of C-section, but let's speak a bit on the advantages, because I know a lot of Ghanaian women, they get scared. There's this perception, say, hey, there's that vibe, like, hey, natural, and there's this stigma around C-sections that C-sections are bad. If you have a C-section, that means you are not a woman, and that means there's something wrong with you. But that isn't always the case. So what are the advantages truly of C-sections?
Okay, we were saying labor is work. Labor is difficult. Labor, as you are going through labor, when you get to second stage, baby must come out or fetus must come out. And it gives trauma the perineal area or the perineal region, because see this small vagina, it has to overstretch for baby like 2.5 and above to come out. Yes, if you can imagine how 2.5 will weigh, that is the least. Some mothers can deliver 4 kg, and it is through this same vagina. So trauma to the perineal tissues will be avoided when you go through C-section. Yes, and also loss of bladder control. When in the course of labor, you can get to a stage that fetus will be stuck in the perineum or the pelvis. And when it's in the pelvis, it's pressing a lot of tissues. Yes. And these tissues, when they are being traumatized, can cause fistulas. Yes. So when you go through C-section, it means you have escaped this. Yes. And also loss of bladder control. And the ureters are not a exception of these traumas. So after delivery, abrasions caused to the ureters can deprive you of urinating after delivery. And also abrasions to the pelvic area, the perineum also deprive you from urinating, because in the urine we have sodium. So when the urine comes out, it causes burning sensations. So after delivery, most mothers don't want to urinate, of which it also brings another complication. I'm not talking about that now. Yeah, so when you go through C-section, you escape all this. Yes.
Okay. Wow. I can see that there are a lot of benefits. And what would you say to our mothers that feel that stigma? Why do you think that happens? That some mothers are like, hey, C-section there, hey, naturally. You've heard that before?
Yes.
Several times.
Yes, several times. Some are, I'll say, religiously, have religious backing, and some too have family. I would say, she thinks all her siblings, her mother went through, maybe they are 5 or 6, and her mother gave birth through vaginal birth. All her siblings have given birth through per vagina. Why is it that it goes to her turn and she's supposed to go through cesarean section? So she has this notion. Yes, that why am I supposed to go through this? Yeah, so she will deny going through it, or even though you advise, counsel her, she still wouldn't like to go through. So such patients or such clients, when you book them, they don't come. Yes, and most of them come in a worse state, because she has fallen under a criteria that she needs to go through cesarean section, and she's running away from it. And fetus or baby cannot stay in there for more than 40 weeks. Definitely, it has to come out. Yes. So sometimes I even get amazed when some people are saying, and me say for 1 year. I ask myself, why was that where you were attending clinic? Didn't they even think of sectioning you. Why should you get pregnant for a year? Yes, so you know there's stigma also attached. You know, as I said, and my siblings have gone through vaginal birth. My mom, even my friends, none of my friends, I know some have peer pressure, even though they are grown-ups, yeah. So she will escape it. She didn't come. She will come back in the breast kit. Some come back with the fetus dead.
Oh.
Yes. And other complications.
So really, if you're advising C-section for a patient, then that means that it's really necessary. Know what they need. And so please, our mothers out there, I know that there's some stigma. Sometimes I go to church and the testimony is, hey, me will naturally. That's the testimony, you know, like God has done it. God has done it. And that's the testimony. And so to our mothers out there, please, if your doctor is advising a C-section, then there is truly a need for it. Don't try and run away from it, because I know that when you give birth vaginally too, there's pain.
There's pain.
Long after, there's pain, there's bleeding for how long? And so I don't see that there's much difference between, some people feel like, oh, if you cut me, it will take long to heal. But sometimes they even cut their vagina as they are delivering the baby. And so really, don't be too scared of a C-section. Find out, do your own research. Don't just listen to what other people have said to you. And that's why we are here on our well-being segment.
Well,
so that
before
you
you
can
go,
truly
not to
learn.
cut you, before you go, I had one more question. In fact, it was even in my head. I don't even know why I didn't ask. When can you have sex after a C-section?
Okay, so you know the uterus and the maternal hormones, everything returns to its non-pregnant state after 6 weeks. So after 6 weeks, you can have sex.
After 6 weeks. Okay, so you've heard it from the nurse. After 6 weeks, you can have sex. Aiko, over to you.
Definitely. Well, now that we've heard from her, we want to open our phone lines in case you are interested in calling in. You've learned something, or you have a few questions that you want to ask. Like I was saying earlier, we are here to give you that information. Do your research. Don't just listen to what people are saying. We have a midwife here. I'm going to be mentioning the number very soon, so get your phones ready so you can call in. We have our midwife here, Mrs. Vida Sante, who is willing to answer all our questions. The phone number is 0302 729 823. 0302 729 823. Okay, so like I was saying earlier, if you are looking for advice, it's important that don't just listen to what other people have said to you. That you say that, oh, because this person said this, then that means that it is true. But you need to do research for yourself. Make sure that you are keeping yourself safe from any harm. Make sure that you are making the best decisions for yourself. So, Mrs. Vida Santi, just brief us a little on the procedure when it comes to delivery. We know that we have vaginal birth. We've learned about the complications and advantages of C-sections, but let's talk about the disadvantages of vaginal birth as opposed to the C-section. What would you say that the C-section has that vaginal birth doesn't have?
Okay, so say vaginal birth, we have hours. Yes. Ideally, a mother that hasn't delivered before can go for a maximum of 18 hours. Yes. And then you'll be in pain for 18 hours. You can just imagine.
You'll be in pain for 18 hours. 18 good hours. Half of the day. Half of the half will go.
It's even
3/4 of the day.
18 hours of
Maybe you sleep and wake up and
you can't even sleep.
You can't sleep.
You can't sleep, yes. And comparing that to C-section, C-section, when it is elective, there is
You
no
choose your
pain.
time.
Yes, and
You
then
come and sit
you
down.
just walk to the theater, you lie down, they clean you up, and then they cut and take baby out.
Look at Aiko is smiling.
Okay, we have a caller on the line. Hi, your name and where you're calling us from? Oh, unfortunately, we lost that caller. The number again is 0302 729 823. 0302 729 823. 8823. You can always call in and send, ask your questions, give us any contributions. If you feel like we've lied to you on the show, of course, you can also call in and tell us where we went wrong.
Tell us your mind.
The number is 0302 729 823. Okay, so let's go back to the vaginal birth. So 18 hours of labor. I can't do that.
And if you have delivered per vagina before, meaning this is the second time or third time, the hours reduces.
Okay.
Because with that, the pelvis and the uterus has gone through labor before, so it knows how to respond to this time round.
Okay.
So that one you can take like 12 hours or less.
Okay, let's talk about recovery. Okay, what's the recovery process for cesarean sections like? Aside from diabetic patients who might have a longer recovery, what's the recovery like? How long before the wound heals? Is it painful? Is there any medication that is prescribed to reduce the pain? What is it like?
So after C-section, as you are going through it, we take pain out. But after the anesthesia wears off, you start experiencing pain or having pain.
Wow.
So we have to manage this pain with pain reliefs.
Yes.
So you'll be put on pain relief for some time.
IVs or IVs?
Injections.
Injections.
Yes. And then from there we put you on oral. So you take the oral home and continue.
Okay, hold that thought. We have a caller on the line. Hi, your name and where you're calling us from?
Samuel, I'm calling from.
Samuela, please reduce the volume of your TV set and tell us what you have to say.
I'm calling from Kaswa.
Okay,
I want to
Samuela.
know that when you deliver freely, the vagina becomes big sometimes. There are situations where the vagina has its time to move back to its normal size. So they can't, and I've heard that there are cases where when the vagina is too big, it's really full. Are there cases like that, or how does it work?
Okay.
And how long does it take for the vagina to replace after having
Okay, Samuela, thank you. Mrs. Asante, did you hear
So
that?
she was saying vagina becomes big after vagina
Delivery.
Birth. And how long does it take to get
go
back?
back.
There's also this popular conception that once you give birth, like,
everything else.
yes.
True, yes.
Okay.
Yes, it's true. There is this.
Okay, before you answer that, we have another caller. Unfortunately, we lost that. Would have taken all the questions and answered them at once. Okay.
So we have this. There's this. I would say, the walls of the vagina you call it rugae. It has a rough appearance. That is how the vagina was made, and this appearance is supposed to stretch in the course of labor, or to accommodate.
Please hold that thought. We have a caller on the line. Hi, your name and we lost that caller. Please go ahead.
Or to accommodate the manhood in the course of sexual intercourse. So after birth, during birth, this rugae must stretch. So it will overstretch for fetus to pass through. So after birth, it wouldn't be as someone who hasn't delivered before. So after 6 weeks of birth, we normally teach our clients how to do pelvic floor exercises. Yes, to get it. You didn't get it 100%, but at least you can get like 80 or 90 years. So we do pelvic floor exercise and then normal exercises to get it contracted.
What's the exercise like?
No, we have the Kegel exercise,
Okay.
which is holding yourself for some minutes or seconds, and then you release yourself slowly, as you feel like weeing, but there's no appropriate or any place for you to. How you go. That's how the Kegel exercise is done. So you do it for involuntarily or voluntarily. You do it. Yes. any number of times throughout the day. Yeah.
Women who go through C-sections, do they have this experience where the rugae expand and cannot?
No.
Oh, so for them it's always 100%.
You have to make you an advocate for C-section. The way you feel.
I was born through C-section. Maybe that is why.
Okay.
But yeah, okay. So we are learning a lot. That's also one advantage of C-sections. So that means
the rugae is always intact.
Okay.
Yes. You know, this vaginal birth, there are some mothers, because of the pain they have gone through, some have to be given episiotomy before baby comes out. And some too, as baby is coming, he sustains tears. So after suturing, you are okay. But some refuse suturing. You see, some refuse. Even though we give anesthesia, local anesthesia before suturing, but some refuse. Because of...
When you say suturing, what part of the body are you suturing?
The vulva, the perineal area.
Okay.
Yes. And it goes, some are very extensive that it gets to the vagina. We have extensive tests. So we have it in degrees. That's first degree, second and third degree. So the third degree, it has gotten to the anal area. Yes. So we suture it, and some refuse it. And you know, patient's right. If she says no, you don't have to force. Even though you can counsel her, try to make her understand the reason why she should do it, but some will still refuse. And when she gets home and everything is healed,
Have there been accidents in the, while performing C-section, like maybe the instrument has gone to touch the baby and it did this and it did that? Has there been, situations like that?
Yeah, sometimes it happens. Baby comes out and sometimes there's a little cut on the cheek. And then if it's presenting with the bottles too, sometimes there's a little cut. And with the forceps, some use forceps to deliver the head. And these forceps can also cause abrasions on the fetal face. Even yesterday I saw one. There was bruises here, and then I realized it was a forceps.
Does it heal?
Oh yeah, it heals.
Without scars or with scars?
So you don't need to have any special treatments for it?
If it is big or extensive, you have to treat it as a normal wound. But if it's normal, just an abrasion, and some of the cuts who are deep, that we suture. Yes. Okay. Maybe it can be due to the urgency at which the surgeon wants to get the baby out, because baby might be in distress. So maybe the urgency in performing the procedure can bring about such.
I know this is not, it's going to go beyond that topic, but I have to ask this. So I have a friend who delivered last December, and for 2 days the baby didn't lactate, and the midwife told my friend that it's because the baby is tired. Why would the baby be tired? Why is not the mother not tired? Why is the baby so tired that it doesn't want to lactate for 2 days? And for 2 days, after 2 days, immediately the baby started lactating.
Was it vaginal birth?
Yes, vaginal birth. The baby gets tired.
Yes. The contraction.
Okay, hold that thought. We have a caller on the line. Hi, your name and where you're calling us from?
Yeah, my name is Matilda and I'm calling from Kasua.
Hi, Matilda. Anything to tell us today?
Yeah, please, I would like to ask, why can't C-section mothers, when you give birth, you're supposed to, our mothers do this thing, they use something like corset to hold our stomach.
Okay.
For it to go back to normal. I'm wondering why C-section mothers can't do that. That's why some people don't want to, because some are also scared of dying on the table. Sometimes it's not the stigmatization, but it's the fear of the fact that maybe you might not come back. So I would like to know. Thank you.
Okay, thank you for your questions. Okay, over to you.
Gone were the days when, there were no anesthesia, because if you have to go through anesthesia from the ancient days, surgery in the ancient days, they were not giving anesthesia. And what makes most of the clients die on the theater bed is some die out of pain. Yes, pain can cause death. And in this modern era, the pain has been taken out. We give you anesthesia. before surgery. Yes. So as for the dying or the mortality aspect, it's rare, yes,
rare.
except in some cases. Yes. And
then
she also
spoke about
tying or wearing corset. You know, there is a cut on the uterus causing pain. You know, after delivery, the uterus must go through contractions to prevent bleeding. Especially when you are breastfeeding, it contracts. Even those who go through vaginal birth, the course of feeding and this contraction is ongoing. You feel pain, severe lower abdominal pain. Some are so severe that they need to be given IV medications. And assuming you fall under that criteria, that you are the type who have severe after pain after birth, and you have gone through C-section, meaning the uterus has been cut. So the pain at the incisional site, the cut site, you see, the incision site, all these pain coming together, plus the tissues, the abdominal tissues, too have been cut. So you are going through all these pain and you still want to put on corset.
In the pain.
But is it possible? Is it possible that women who go through C-section can still tie their stomach and nothing will happen?
Yes.
Because I've seen women who have actually gone through C-section still tie their
They
tummy.
tie after 4-6 weeks. Most people tie and it's okay. That's when you feel like the wound is completely healed. When the doctor has assessed you to see that the wound is completely healed, you can start tying. Yeah.
There are some ladies with a high pain level tolerance or pain tolerance level. If you are in pain but you still decide to tie your tummy and you are okay with it, does it cause any complications for you? Or once you are okay with it, it's fine, you can tie?
You know, the uterus was sutured. The abdominal tissues too has been sutured. So it can be that you are putting pressure on the suture line. So you can gape.
So it's
and
really
moreover, we want air to be passing through the place freely. And you have now gone to apply this. So.
Yeah, chichre. Okay, so we're glad for that. So that is what someone will say is also a disadvantage of cesarean section, that they cannot tie. But really, at the end, well, everyone in, so it's important that you can weigh your pros and cons and decide what works for you. We've learned that really the chances of dying on the table are low. But do we still have cases where mothers die on the table from C-sections? And what causes that?
I said that one is rare. So
it's extremely rare.
Yes,
but people can actually die from natural birth too.
Oh, yes.
So there's even the risk of dying from natural birth, the same way there's a risk of dying from C-section. So I think that one too you have to weigh. And I don't know, in my head it feels like the risk of dying from natural birth is higher.
Sure.
I don't know, that's how I feel. I don't have any evidence to back that up.
You know, what causes most of these mortalities? It can be PPH, that's bleeding after birth.
Okay.
And after C-section, you can bleed. After vaginal birth, you can bleed.
Okay. But at least C-section, we'll see where the bleeding is coming from. But vaginal, you mentioned earlier that sometimes...
Before you know where the bleeding is coming from, you have to reopen.
Oh, you have to reopen.
Yes, because sometimes you might be trying your possible best to arrest this bleeding. The doctor who did, or the surgeon who did the surgery, knows how well he sutured everything. So he knows he did the best work. But then you are bleeding. Where is this bleeding coming from? We have done everything to control it and it's still not controlled. Then we have to go in again.
So that means that with everything, there are pros and then there are cons. Whether there's good, there's bad.
So we definitely have to make that move and decide what is the best for us. I'm glad that we've had a lot of young ladies calling in. You need to be informed. Make your decision. Before you even get pregnant, you should know your plan. Know the plan. Don't just go and be doing style. No, you don't want it like that. Get a plan for yourself. Make sure you know what you're getting into before you get into it, and get into it with the right person. Unless maybe you don't care or you don't mind who you get into it with, but make sure you get into it with the right person. That's my 2 cents on that. Well, I'm sure that we've learned a lot from our well-being segment. We're very glad that you've all tuned in to listen to our talk on cesarean sections today. Well, we're going on a break. We'll be back with our time capsule. Don't go anywhere. Stay tuned.